Vitamin D, aka sunshine vitamin, is one of the most important vitamins for our bodies. And even better, we can make it ourselves by getting out and enjoying the sun. Vitamin D deficiency is one of the most common health problems faced. According to the NCBI, vitamin D deficiency affects almost 50% of the population worldwide. An average daily intake of 10 to 20 micrograms is adequate for individuals, as suggested by the US Institute of Medicine. So in this video, we are going to discuss 12 warning signs your body lacks vitamin D. The video is going to be amazing, so make sure you stick to the end. Before starting the video, be sure to smash the like button and subscribe to never miss out on any of our videos. 12. Muscle pain and achiness. In some cases, vitamin D deficiency can cause muscle pain and achiness. A vitamin D status test can determine whether this vitamin deficiency is at the root of these symptoms. If it is, your doctor may recommend a vitamin D supplement, which may help reduce muscle aches and pains. In other research, a review published in July 2018 in the Journal of the American Academy of Orthopedic Surgery also found supplementing with vitamin D can increase muscle strength among those who are deficient. 11. Fatigue. Feeling fatigued and sluggish is probably the most common sign of vitamin D deficiency. Dr. Gittleman says one previous study suggested that there is a significant correlation between daytime sleepiness and low levels of vitamin D. Vitamin D supplements may help reverse the trend. Another past study of people with fatigue and vitamin D deficiency found that vitamin D treatment improved participants' subjective fatigue rating scale compared to the placebo group. 10. Bone problems. While getting enough vitamin D is essential for bone health, too much can actually have a detrimental effect. Some research have found that having too much vitamin D can interfere with the actions of vitamin K2, which is a nutrient that helps keep calcium in the bones. Research has shown that people who take mega doses of vitamin D are more prone to bone fractures. In another study, participants took either 400 IU, 4,000 IU, or 10,000 IU of vitamin D over a 3-year period. Bone density tests showed no improvement over a 400 IU dose and actually showed decreased density in the highest dose group. Low vitamin D may cause bone pain because vitamin D is necessary for bone health, and a deficiency is linked to osteoporosis, osteomalacia, osteopenia, and osteoarthritis. It follows that any kind of bone issue, bone pain included, could be a strong sign of low vitamin D. Pay attention to your bones and give them what they need. 9. Weight gain. If your appetite has gone through the roof or you are gaining weight, vitamin D may be playing a role. Research has revealed that low levels of vitamin D are associated with being overweight and obese, whereas higher levels of vitamin D are associated with reductions in body fat. This may be because vitamin D helps to control a hormone in the body called leptin, which helps to inhibit hunger and reduce fat storage. If the body is low in vitamin D and struggles to produce healthy levels of leptin, this could contribute to overeating and weight gain. 8. Kidney problems. Lack of vitamin D can also lead to kidney problems or even kidney damage because having too much vitamin D increases the absorption of calcium. It can result in the formation of kidney stones. However, evidence also suggests that more serious, long-term kidney damage can also take place. These calcium deposits in the kidneys can lead to a condition known as nephrocalcinosis, which can lead to permanent kidney damage or even kidney failure. 7. Hair loss. Many foods and nutrients may affect hair health. While stress is a common cause of hair loss, severe hair loss may be a result of a disease or nutrient deficiency. Hair loss in women is linked to low vitamin D levels. Though research is lacking, in particular, studies tie low vitamin D levels to alopecia areata, an autoimmune disease characterized by severe hair loss. One study in people with this condition associated low vitamin D levels with more severe hair loss. In another study, in 48 people with this condition, applying a synthetic form of vitamin D topically for 12 weeks significantly increased hair regrowth. 6. Low immunity, frequent illness or infections. Another important function of vitamin D, keeping the immune system running adequately and appropriately. Some studies have associated lower levels of vitamin D with an increased risk of infection. Before antibiotics were available, vitamin D was used to treat infections like tuberculosis. In February 2017, BMJ found that supplementing with vitamin D reduced participants' risk of acute respiratory tract infection. Those with the greatest vitamin D deficiency, less than 25 nmol/L at baseline, who supplemented at least once a week or daily, reduced their risk of respiratory infection by 50% compared with the participants whose vitamin D levels were 25 nmol/L or higher. One of the most important roles of vitamin D is supporting immune health, which helps you ward off viruses and bacteria and are responsible for addressing infections. If you often become sick, especially with cold or the flu, low vitamin D levels may be a contributing factor. Several large observational studies have shown a link between a deficiency and a respiratory tract infection such as cold, bronchitis, and pneumonia. Recently, vitamin D deficiency has been linked to an increased risk of COVID-19, as well as an increased risk of experiencing severe effects from the condition. However, it is important to note that taking vitamin D supplements at any dosage will not prevent COVID-19. 5. Anxiety. Vitamin D deficiency is linked to anxiety disorders. One review found that levels of calcidiol, a form of vitamin D, were lower in people with anxiety, as well as in those with depression. A separate study on pregnant women found that having adequate vitamin D levels may help reduce anxiety symptoms, improve sleep quality, and even help prevent postpartum depression. 4. Depression. Vitamin D deficiency has been linked to depression, especially in older adults. Although some study results are conflicting, the effects of vitamin D supplements have been mixed, but some reviews have found that they helped relieve symptoms of depression. Still, more research is needed to understand the relationship between vitamin D and depression. 3. Impaired wound healing. Slow wound healing after surgery or injury may be a sign that your vitamin D levels are too low. In fact, results from a test tube study suggest that vitamin D increases the production of compounds that are crucial for forming new skin as part of the wound healing process. Vitamin D's role in controlling inflammation and addressing infections may also be important for proper healing. One older study in 221 people, 112 of whom had diabetes-related foot infections, found that those with severe vitamin D deficiency were more likely to have higher levels of inflammatory markers that can jeopardize healing. 2. Headaches. Headaches are a very common condition that most people will experience many times during their lives. The main symptom of a headache is pain in your head or face. This can be throbbing, constant, sharp, or dull. Headaches can be treated with medication, stress management, and biofeedback. Vitamin D can cause different types of headaches, including migraine. It is because decreased levels of vitamin D may be responsible for bone pain and swelling, which can further aggravate and sensitize your nervous system, causing headaches. 1. Insomnia. Insomnia is a sleep disorder in which you have trouble falling and/or staying asleep. This condition can be short-term, acute, or can last a long time, chronic. It may also come and go. Acute insomnia lasts from one night to a few weeks. Insomnia is chronic when it happens at least 3 nights a week for 3 months or more. Vitamin D deficiency can impact your sleep. Besides hindering the quality of your life, it can also trigger insomnia by affecting your sleep schedule. People living with low levels of vitamin D are seen to have daytime sleepiness and drowsiness. While you might consider eating more food that contains vitamin D and getting a little bit of sunlight, you will likely be told to take vitamin D supplements. Vitamin D comes in 2 forms, D2 and D3. D2, also called ergocalciferol, comes from plants. D3, also called cloacalciferol, comes from animals. You need a prescription to get D2, D3, however, is available over the counter. It is more easily absorbed than D2 and lasts longer in the body, dose for dose. Work with your doctor to find out if you need to take vitamin supplement and how much to take if it is needed. Let us know your opinion in the comment section below. This was all for today. Hope you liked the video. Do not forget to subscribe to our YouTube channel. Please click on the next video clip to watch for more health info. Thank you very much.